Hello everyone, welcome to Dental Surgery Channel. This is Dental Coffee with the Agnini brothers. I want to welcome Andrea and Alessandro to Dental Coffee with, and I'm very happy to have you both today. And I want to appreciate your presence here. I know that it's very difficult to find you because you guys are very busy and you guys are very hard workers. But how are you? How is everything?
Everything is fine. Thank you very much for the invitation. It's a pleasure.
Yes, it's a great pleasure to be here.
Andrea and Alessandro, they are the owners of Studio Agnini, and they are specialized in perio implant prosthodontics. They are a very important experts in digital. They have basically switched and changed the world of digital evolution, and they are experts. They are part of the many publications that have been published and still discovering new things, right? I understand that you guys keep improving and keep renewing the professional dentistry.
That's what digital needs.
Yeah.
If you want to be updated on digital dentistry,
to stay updated always.
So today we are going to speak about the digital evolution. I understand that Andrea and Alessandro have been working with digital for a long time. I consider them one of the pioneers and the authors of a lot of books about digital evolution and digital revolution that I strongly recommend. And one of the important things that they own the Studio Agnini, which is located in Modena, where you guys have your own practice and where you also have your courses, right?
Yes, also in Sassuolo, two offices.
Okay, Sassuolo and Modena.
And Sassuolo.
And in between we have Maranello, in where the Ferrari factory is held. So as you know very well, when everybody comes here, we bring them to the Ferraris.
It's
so
very
they have
important.
a lot of fun.
Very
more fun than what we have here in the training center for sure.
So, Andrea and Alessandro, you know the masters of modern dentistry and the curators of digital dental revolution and the pioneers, as I said before. But I want to know, and let's speak a little bit to the audience about your beginning of your story in digital. When and how did you start believing in digital?
Yes, first of all, the beginning of the digital dentistry started with the CAD/CAM revolution, who affected our labs in the early 2000.
Yeah, more
or less. Then, starting from 2011, with the introduction in our facility, in our clinical armamentario, the first prototype of intraoral scanner. And we began our journey towards the full digitalization.
But what we would like to point out, and I think that's extremely important and relevant to highlight, is that digital dentistry is just like one piece of the puzzle. It's not that digital dentistry is solving your cases. I mean, digital dentistry is just a working tool that affects each branches of dentistry and increase like the accuracy, can shorten the working process passages. But traditional dentistry and traditional background is still the key to succeed. That's a very important statement that we would like to highlight, because traditional dentistry is here to stay. The traditional knowledge is the one that is treatment planning the case. And now the sequence of the therapy is made following the traditional knowledge and background. That's extremely important.
So it would be like the part of the workflow process, right? Initiating everything with a, let's say, for example, impressions, make a wax up out of a DSD, for example, and then you make your surgical guide out of the prosthetic surgical guide, and everything is connected by digital. When we are speaking about digital, we are connecting all the pieces of the puzzle, as you said before, connecting the surgical part with the prosthetic part, with the analyzing, everything, right? So this is
yeah, you said perfectly. Because you should see, I mean, our belief is that you should see digital as an ecosystem in where you can take, depending on what you need, like several apps for Invisalign if you want to do ortho, for virtual planning and computer guided if you want to do computer guided surgery, for finalization of restorative implant prosthetic digitalization. I mean, digital dentistry is an ecosystem inside of which you can take different pieces depending on your needs.
And this is why the message is important for the people that especially are starting to see digital. Whenever you go to a Expo Dental, for example, here in Madrid, and you see everything that it's digital, and people are becoming virtual followers of everything that it's digital. When you enter these big facilities and you see the scanner, not only the 3D scanner, or the not 3D scanner, I mean the CBCT, it's already like completely accepted. So now we are seeing new intraoral scanners. We're seeing all the CAD/CAM technology that involves people that are actually having the milling machine inside the office also to link the digital with also the creation as well of the prosthetic part. So for the people that are starting to accept the digital from the beginning, let's say that they are finishing the university and they see all this digital world, that they are in a little bit lost. What would you consider would be a key factor, or how would you explain the benefits of turning into digital nowadays? Yeah. And basically, what would be the benefits?
Yes, first of all, I would say to them to get on the digital train as soon as possible, because the advantages are incredible. Try to think improving the acceptance of the treatment plan by the patient, and improve the communication with the other collaborator, improve the communication with our lab technique, but not only that, also the performance, no, in the technical side.
Yeah, not only on the data collection, as Alessandro was mentioning. Try also to think that digital photography is digital dentistry as well, but intraoral scanning can help you in starting to get like the initial record of the patient when you walked in the practice, and you can double check like how the recession are changing or evolving, or if you did like some connective tissue graft augmentation, if this augmentation is stable over time, or if you're getting shrinkage. So it's extremely important like to collect some data that are important for communicate with the patient in an easier way. So this is improving the treatment plan acceptance, for example, but also in the data processing, in the sense that once we establish what is the treatment plan sequence, then if you have a plan which is digitally made, right now we do have like specific software. Try, for example, to think about the DSD virtual planning, the DSD virtual center, that are guiding us in standardizing each phase of the treatment plan. For example, if we have decided to do a gingivectomy of like 1.2 millimeters, we have like a specific software that can 3D print like a gingivectomy guide that tells us exactly that we are improving, that we are doing that gingivectomy by 1.2 millimeters. So this is standard. This means to standardize the processes.
Yes, also another aspect to consider is that with the digitalization, there is a tendency to increase the level of the quality of everyday dentistry, respect the analogic part.
And this is great for the young dentists, as you were asking in your question, which they are embracing these new technologies as soon as they come out from the university. This is a great advantage for them, because they can have a shorter learning curve rather than in the analogic age.
So going back to the digital scanning, or let's try to, as you said before, Andrea, the digital is the ecosystem. But maybe the people or the audience wants to focalize a little bit more about, let's say that I want to invest money to something. How would I start? Like, for example, would you think that, even though I'm not part of that workflow yet, but would you think that, or would you consider that intraoral scanner would be a good investment today to have in the clinic? Obviously, you're going to say yes, but I want you to consider a little bit of the evolution of the intraoral scanner, how it has evolved over the years, and how many issues were solved from the initial intraoral scanners to the nowadays intraoral scanners?
I say one thing and then I let Alessandro speak. Whenever they have to go towards like buying something, new practitioners should team up with a dental technician and learning together how to finalize the digital workflow. Not only the intraoral scanning, but also the next step, how to process the data that are coming out from the intraoral scanners.
This is the incredible concept because you have to create a team with your lab technician. First of all, lab technician in a digital way, in the digital world, and you can start with the digital.
Okay.
So together follow the path.
But I think that for sure the softwares, the knowledge, the materials, the hardware are consistently evolving. I mean, you ask us what has changed. I mean, if we compare it from 2011 to now, it's completely changed.
Common question.
And the possibilities that we have today are not even comparable to what we had in 2011, because the main actors like the intraoral scanning technology, the CAD/CAM softwares, the milling machines, the 3D printers, the factory that are building and producing materials at their learning curve as well. So they improved, and the evolution is going and growing faster and faster, much faster than what the literature is saying.
We are in a technological decade, right? And now everything is evolving very fast. I personally think that it's too fast sometimes. You acquire intraoral scanner and the following year you have the new version, right? Or you have an update of that intraoral scanner that is giving you improvements already. This is very interesting. I had the chance to be in Modena in 2016. I am so honored that I had the chance to meet with you guys and learn from you one of your courses. And I understand that you not only have a presence courses, but also you have an online course. I would like you to share with the audience as well. Where can they actually update their knowledge? What solutions do you give in terms of learning, or the most beneficial course that would you consider that the people should know about if they want to initiate into digital?
Well, so far we still don't have like a digital online learning, and we're gonna launch it in 3 weeks at NYU at the Dental XP Digital Summit. We created together with our DDR educational team the first online digital dentistry fellowship in partnership with Dental XP, in where basically we incorporated our experience on that, but more than 70 hours of online learning education, in where we included the last concept in terms of digital education, which we called the digital dental recipe. As Alessandro was mentioning before, what is missing are the dots after the intraoral scanning has been taken. So for each workflow that is going to be explained and covered, from single implants to full arch, to natural dentition, to night guards, to communication, to treatment planning, we did several recipe in where we really explaining all the ingredients on how to be or how to try to be successful in a full digital environment, which is really the key if you want to get the best out of digital dentistry. Try to be fully digital. So that's the bottom line. And of course, not only online education, but our training center is always open, and we put several courses per year, let's say 1 course per month on digital dentistry, where people have the opportunity to see from A to Z, from the implant placement to the impression taking, to the lab work, to the delivery of the PMMA provisionalization, for example.
Yes, we try to cover. Yes, we try to cover all the digital workflow in our courses. So starting from the patient in the live session, with the prep department of or replace an implant, no? Or place an implant and then take an intraoral scan with an intraoral scan the impression, and then also the technical digital workflow.
Very interesting.
Try to cover everything.
Very interesting.
So I'm trying to like some tips and tricks, which is what I think the attendees are caring the most. You know, they come here, they see maybe a nice restoration or nice presentation, but we give them something to bring home and starting from scratch on Monday, and it's sort of like recipe, like to do a cake, to follow the Monday morning to do, okay, I want to do a night guard. What should I do? What is the scanning plan? What is the scanning strategy? Depending on the intraoral scanner that is utilizing, because we have experience with many different intraoral scanners, and also this is important. The technology behind the system is another aspect which is extremely relevant.
How many days usually covers the courses that you guys take in there in Modena and Sassuolo?
It depends. I mean, for Italians, we have like 1 day course, but we do also have like 2 days or 3 days program, depending on the specific needs of the group. And whenever we do have a group or a company that wants to organize a group like of international people, of course, you know that we like to prepare like not only the educational program, but also the social program. So we do have like different dinners, different social activities between Ferrari and Pavarotti. So we do many different things.
Very interesting.
So
very interesting.
Fun and learning.
It's good and entertaining, of course. So, guys, I want to appreciate your presence in Dental Coffee With. Today we had a Dental Coffee with the Agnini brothers. I want to thank you very much for giving us all this information, especially for the audience that actually are not found themselves into this digital world. And probably if I recently became a dental doctor, I would be amazed with all this digital workflow that I didn't know, that I did not have in my university when I became a doctor, right? When I became a dentist. So guys, thank you so much for your presence. I want to appreciate your professionalism, and every time that I ask you a favor, you've been always ahead of time, you know, very ready to collaborate and cooperate. I want to thank you for your support.
Sorry? Thank you for the invitation, Nicholas.